My name is Peter Wren-Hilton. I'm 58 years of age. I live in Tauranga in the wonderful Bay of Plenty here in New Zealand. There's a nice photograph of you and
my mum.
I'm married to Jackie. We've been married now for 18 years.
In the wedding, Peter laughed during our vows. I'm not sure if it was in sickness and in health or the for richer for poorer. I think the richer for poorer.
I think it was definitely the richer for poorer. Famous day 18 years ago. Can't believe it's 18 years. I only became aware of the potential problem literally the day that I went to the loo and there was blood in the urine.
I said, you need to go to the doctor and you need to go now.
I was given the CT scans and all the other kind of tests and met Andre, my urologist, a week after that.
So Peter presented with blood in the urine, completely out of the blue. He had an ultrasound scan that showed some calcified tumours, bladder cancer.
The whole thing around that time is I actually felt no pain. I didn't feel any suffering. I think this is one of the cruel things about that type of cancer, the fact that unless you get a very physical symptom, you're probably not aware that you've got it. So these are my two sisters, Jill and Anne. They were clearly shocked when I had to make that phone call to let them know that I'd been diagnosed. My mother had passed away with bowel cancer in 2003, and my other sister Sue, she also has had cancer. She's had breast cancer. So when I told them my news, they were shocked. And of course, being in the UK, the other side of the world, meant that they were a very, very long way away from New Zealand. I've actually had 3 operations in total. The first operation removed the 3 tumours, and then the subsequent 2 operations were really just internal checks to make sure that the stuff had not returned. And 2 years on, I'm clean.
Peter, it's time again. Welcome along, mate. Yeah, come in.
Thanks very much. One of the things about a T1 cancer is that there is a 70% chance of it returning. So the key thing is to catch it early. We're going through these procedures for another, I guess, 12 months as part of the 3-year maintenance program that Andre's put me on.
In terms of follow-up, a flexible cystoscopy, it's pretty invasive. We put a local anaesthetic in the urethra and then pass an instrument down into the bladder and are able to have a pretty good look around. So unfortunately, it is a long-term, follow-up for you. Yeah. I'm afraid.
No, that's. No, I'd rather catch it than not. I also use CX Bladder, and you can take that as often as you like. You urinate into this small device here. You close the top by placing the lid back on. You then shake it up. You then remove this tab like that. You take this here, that's got the magic solution inside. You place that down there and press, and that effectively then brings the urine into the sample area here with the CX Bladder magic source. And once that's done, you can then take this out. They provide you with a courier bag to send this back to their test labs. Within 2 or 3 days, you get the test results back, and it's either thumbs up or another trip to Andre, my urologist. Fortunately, to date, it's always been thumbs up.
Patients do get a lot of peace of mind, I think, from a CX Bladder test done, and particularly if it comes back normal, then they can think, well, that's great, I don't need another look inside my bladder for another 3 or 4 months. And I personally have enough faith in that CX Bladder test to be able to use it.
When I get the all clear, obviously immense relief, not just for myself, but again for my wife and family. We know we've got kind of another 6 months on.
But yeah, very scary, very stressful, but you just go through every process. In fact, I've got 15 corks, champagne corks, and everyone's got a date on it, and some I've still got to put, but that was last week's. Every time Peter had an appointment or a checkup or an operation, afterwards we'd kind of crack a bottle of something nice and keep a record of it.
There is another resource which you can access really easily. It's called bladdercancer.me. It's an online portal that's been built for people who are either suffering from bladder cancer or patients or people who have just been diagnosed. And it's really a great support portal. You can share experiences with other people, talk to professionals, find out the most up-to-date information. I would advise anybody who has bladder cancer or has family or friends who've got bladder cancer to go to. It's just a very good resource to have. The major impact it's had on my life is that I don't probably work the hours I used to work prior to the diagnosis, so I, in some ways, enjoy life a lot more. I think I'm a much more relaxed person since, and I take things a little bit more calmly and not quite perhaps as manic as I was prior to the diagnosis.
You know, we try and be positive. We're very positive people. We love life and just got to get on and deal with it. And having CX Bladder kits are perfect for helping kind of, I guess, not prevent it, but tell you if there's an issue so that you can then go and get it dealt with.
The messages I give to everybody is that, you know, this is not something that, you know, life stops. When you're diagnosed with cancer and you are properly treated and it's clear, then, you know, life goes on. You probably just take a slightly different perception of life and appreciate things around you more than you did previously.